Welcome back to our channel. Have you ever experienced the fear and uncertainty that comes with kidney disease? You're not alone. But today, we're here to share some incredible news that might change everything you know about this condition. Imagine a future where no one with kidney disease has to worry about losing a kidney again. It sounds unbelievable, but it's not just a dream. Thanks to recent scientific breakthroughs, we're on the cusp of a revolution in kidney health. A groundbreaking study involving over 400 participants over an astonishing 8 years has revealed insights we never knew before. And the best part? We'll show you how even those in the advanced stages of kidney disease, yes, stages 4 and 5, can regain their health. We're going to unveil the 5 transformative steps that are empowering kidney patients to take charge of their health and rewrite their stories. Are you ready to embark on this journey towards a healthier, brighter future? Let's start this life-changing path together, right now. Step 1. Mastering. Oxalates. Oxalates are naturally occurring compounds found in many plant-based foods. Common sources include leafy greens like spinach, root vegetables like beets, nuts, seeds, and even chocolate and tea. While these foods are often part of a healthy diet, oxalates can pose a risk to kidney health when consumed in large amounts. When oxalates are ingested, they can bind with calcium in the urine, forming calcium oxalate crystals. These crystals can accumulate and develop into kidney stones, a painful condition characterized by sharp abdominal pain, blood in the urine, and difficulty urinating. The presence of oxalates can also lead to hyperoxaluria, a condition marked by excessively high levels of oxalate in the urine. Hyperoxaluria can result from dietary habits, genetic mutations, or intestinal disorders that increase oxalate absorption. Calcium plays a dual role in managing oxalates. While calcium can bind with oxalates in the urine to form stones, dietary calcium can actually help reduce the risk of kidney stones by binding with oxalates in the intestines. This prevents oxalates from being absorbed into the bloodstream and eventually reaching the kidneys. A study published in the Journal of the American Society of Nephrology emphasizes that calcium-rich foods like low-fat yogurt, milk, and cheese can effectively bind with oxalates, thereby reducing their availability to form kidney stones. Drinking plenty of fluids, especially water, is crucial for flushing oxalates out of the kidneys. Increased fluid intake dilutes the urine, lowering the concentration of oxalates and calcium, and thereby reducing the risk of stone formation. Medical guidelines often recommend consuming around 3 liters of water per day for individuals at risk of kidney stones. To minimize the risk of kidney stones, it's advisable to limit high oxalate foods and substitute them with lower oxalate options. For example, instead of spinach, you can opt for low oxalate vegetables like cauliflower, cucumbers, and peas. Additionally, boiling vegetables can reduce their oxalate content, making them safer for consumption. Fiber also plays a significant role in managing oxalate levels. High-fiber foods such as whole grains, fruits, and vegetables can bind with oxalates in the gut, preventing their absorption. A study highlighted in the Clinical Journal of the American Society of Nephrology found that fiber intake helps reduce the amount of oxalates reaching the kidneys. For those with genetic forms of hyperoxaluria, medications such as vitamin B6 and potassium citrate may be prescribed to reduce oxalate levels. Lifestyle changes, including reducing salt and sugar intake and limiting animal protein, can also help manage oxalate levels. Managing oxalate levels involves a combination of dietary choices, adequate hydration, and, in some cases, medical intervention. By understanding the role of oxalates and taking proactive steps, individuals can reduce their risk of kidney stones and maintain better overall kidney health. Step 2. Embracing fiber to fight. Uremic toxins. Uremic toxins are harmful substances that accumulate in the bloodstream when kidney function is compromised, as often occurs in chronic kidney disease, CKD. These toxins, including creatinine, urea, indoxyl sulfate, and p-cresyl sulfate, result from the breakdown of proteins and other metabolic processes in the body. They can cause significant damage to various organs, including the heart, blood vessels, and bones, and contribute to the progression of CKD and related complications. Soluble fiber plays a crucial role in managing these toxins. When soluble fiber is consumed, it mixes with water in the intestines to form a gel-like substance. This gel binds with uremic toxins, preventing their absorption into the bloodstream and promoting their excretion through feces. This binding action helps reduce the overall toxin burden on the kidneys, which can be particularly beneficial in slowing disease progression. Acacia fiber, derived from the sap of the Acacia Senegal tree, is a particularly effective type of soluble fiber. It has a high content of soluble fiber, around 85–95%, and has been shown to significantly reduce levels of harmful uremic toxins like indoxyl sulfate and p-cresyl sulfate. These toxins are known to contribute to kidney damage and cardiovascular issues, making their reduction a key therapeutic target in CKD management. Additionally, soluble fiber supports the growth of beneficial gut bacteria, which produce short-chain fatty acids like butyrate. These fatty acids help maintain the integrity of the intestinal barrier, reduce inflammation, and improve overall gut health. Incorporating a higher intake of soluble fiber into the diet can help CKD patients manage their condition more effectively. The recommended daily intake is 25 to 35 grams, which can be achieved by consuming foods such as whole grains, fruits, vegetables, legumes, nuts, and seeds. For those who find it challenging to meet their fiber needs through diet alone, prebiotic fiber supplements like inulin and fructooligosaccharides can be beneficial. These supplements enhance the growth of beneficial gut bacteria, further aiding in the reduction of uremic toxins. By prioritizing fiber intake, individuals with CKD can potentially delay the progression of their disease, reduce toxin levels, and improve their overall health outcomes. For more detailed guidance on managing uremic toxins through diet and supplements, consulting a healthcare professional or a renal dietitian is advisable. Step 3. Increasing your vitamin D intake. Vitamin D is essential for various physiological processes, particularly in individuals with chronic kidney disease, CKD. The kidneys play a crucial role in converting vitamin D into its active form, calcitriol, which helps regulate calcium and phosphorus levels in the blood. This regulation is vital for bone health, as well as for preventing vascular calcification and maintaining proper functioning of the parathyroid glands. In CKD, the kidneys lose their ability to convert vitamin D efficiently, leading to deficiencies. This deficiency can exacerbate conditions like secondary hyperparathyroidism, SHPT, where elevated levels of parathyroid hormone, PTH, cause the body to draw calcium from the bones, weakening them and increasing the risk of fractures. HPT is common in CKD patients due to imbalances in calcium, phosphorus, and vitamin D, often leading to mineral and bone disorders collectively known as CKD-MBD. Vitamin D obtained from sunlight, food, or supplements undergoes two hydroxylations in the body for activation. The first occurs in the liver, converting vitamin D to 25-hydroxyvitamin D, 25-OHD, the main circulating form and marker of vitamin D status. The second occurs in the kidneys, where 25-OHD is converted to the active form, 1.25-dihydroxyvitamin D, calcitriol. Calcitriol binds to vitamin D receptors in various tissues, including the intestines, bones, kidneys, and parathyroid glands, facilitating the absorption of calcium and phosphorus from the gut, promoting bone mineralization and modulating immune function. A deficiency in active vitamin D can lead to inadequate calcium absorption, resulting in bone demineralization and conditions like osteomalacia in adults and rickets in children. It also contributes to osteoporosis, increasing the risk of fractures. In CKD, reduced calcitriol levels cause an overproduction of PTH as the body tries to maintain normal calcium levels. Elevated PTH levels lead to excessive calcium release from bones, weakening them. This condition, known as secondary hyperparathyroidism, can also cause calcium deposits in soft tissues, including the heart and blood vessels, leading to complications like cardiovascular disease. Moreover, vitamin D has immunomodulatory effects, meaning it helps regulate the immune response. Deficiency can impair the immune system, increasing susceptibility to infections and possibly contributing to autoimmune conditions. Additionally, vitamin D has been linked to the regulation of inflammatory processes, which are often elevated in CKD. For CKD patients, managing vitamin D levels is critical. The typical recommendation is to maintain 25 or OHD levels above 30 ng/ml. This can often be achieved with a daily intake of 2000 IU of vitamin D, though the specific dosage may vary depending on individual needs and the severity of CKD. For those with significant deficiencies or specific complications like SHPT, healthcare providers may prescribe active forms of vitamin D such as calcitriol or analogues like paracalcitol, which are directly active without requiring kidney conversion. Regular monitoring of vitamin D, calcium, phosphorus, and PTH levels is essential in managing CKD. Oversupplementation should be avoided as it can lead to hypercalcemia, excess calcium in the blood, which can cause symptoms like nausea, vomiting, weakness, and more severe complications like cardiac issues. Vitamin D is a critical nutrient in managing CKD, influencing bone health, mineral metabolism, and overall immune function. Proper supplementation and medical oversight can help mitigate the risks associated with vitamin D deficiency and support better health outcomes for CKD patients. Step 4. Identifying and addressing the root cause. Addressing the underlying causes of kidney disease is crucial, especially since a significant number of cases are linked to diabetes. Diabetes, particularly type 2, is a leading cause of kidney failure, accounting for a substantial proportion of chronic kidney disease, CKD, cases. This connection arises because high blood sugar levels can damage the tiny blood vessels in the kidneys, impairing their ability to filter waste and excess fluids from the blood. Over time, this can lead to kidney damage, high blood pressure, and an increased risk of other complications, including heart disease and nerve damage. In managing diabetes-related nephropathy, controlling blood sugar levels is essential. This can be achieved through a combination of dietary changes, medication, and lifestyle modifications. For instance, reducing the intake of high sugar and high fat foods, increasing physical activity, and maintaining a healthy weight are critical steps. Certain medications like angiotensin-converting enzyme, ACE inhibitors, and angiotensin F2 receptor blockers, ARBs, are particularly effective in lowering blood pressure and slowing the progression of kidney damage. In addition to medical treatments, natural remedies can also play a role in managing diabetes. For example, apple cider vinegar, ACV, has gained popularity for its potential benefits in lowering blood sugar levels and improving insulin sensitivity. Incorporating ACV into your diet, such as by mixing 1 to 2 tablespoons in water before meals, may help manage diabetes and, consequently, reduce the strain on your kidneys. However, it's essential to consult with a healthcare provider before making any significant changes to your diet or treatment plan, especially for individuals with pre-existing health conditions. Furthermore, early detection and regular monitoring of kidney function in diabetics are vital. Tests such as urinalysis, blood tests for creatinine and blood urea nitrogen, Balman levels, and imaging studies can help assess kidney health and guide treatment decisions. Maintaining optimal control of blood pressure, blood sugar, and cholesterol levels can significantly slow the progression of kidney disease and improve overall health outcomes. Step 5. Making simple dietary adjustments. When managing chronic kidney disease, CKD, specific dietary changes can significantly impact your health and slow the progression of the disease. Firstly, reducing sodium intake is crucial for controlling blood pressure and preventing fluid retention, which can strain the kidneys and heart. It's recommended to limit sodium to 1,500 to 2,000 mg per day, depending on the stage of CKD. This means avoiding processed foods, canned soups, and snacks like chips, which often contain high levels of sodium. Instead, focus on fresh ingredients and flavoring your food with herbs, spices, and salt-free seasonings. Depending on your kidney disease stage, you might also need to watch your protein intake. For those not on dialysis, a lower protein intake is often recommended to reduce the buildup of waste products in the blood. A typical recommendation is 0.6, 0.8 grams of protein per kilogram of body weight per day. For patients on dialysis, the protein requirement may increase to replace losses during treatment. It's important to consult with a healthcare professional to tailor protein intake to your specific needs. While potassium is essential for muscle function, too much can be harmful, especially in advanced CKD stages where the kidneys struggle to excrete excess potassium. High potassium foods like bananas, oranges, tomatoes, and potatoes should be limited. Instead, opt for lower potassium alternatives such as apples, berries, and grapes. It's also wise to avoid salt substitutes that contain potassium. Phosphorus can accumulate in the blood when kidney function is impaired, leading to bone and cardiovascular issues. Limiting phosphorus intake involves reducing consumption of dairy products, processed foods, and certain beverages like dark colas. It's important to check food labels for phosphorus additives, which often appear as ingredients with phos in their names. While calcium is crucial for bone health, its balance must be carefully managed. High phosphorus levels can lead to low calcium levels, prompting the body to pull calcium from bones, weakening them. It's essential to follow a balanced diet and avoid excessive calcium intake from supplements unless recommended by a healthcare provider. Staying hydrated is important, but the amount of fluid intake should be monitored, especially if fluid retention is a concern. The right amount of water depends on individual health conditions and kidney function, so it's best to consult with a healthcare provider. Making these dietary adjustments under the guidance of a healthcare professional or dietitian can help manage CKD and improve overall well-being. To conclude this informative and insightful discussion, it's evident that taking proactive steps can significantly impact the management and progression of chronic kidney disease, CKD. From understanding the importance of managing oxalates and incorporating fiber into your diet to ensuring adequate vitamin D intake and addressing underlying conditions like diabetes, these strategies collectively empower individuals to take control of their kidney health. Simple dietary adjustments such as reducing sodium and phosphorus intake and carefully managing protein and potassium levels play a crucial role in maintaining kidney function and overall well-being. Ultimately, the key takeaway is that by adopting these scientifically backed measures and working closely with healthcare professionals, individuals with CKD can improve their quality of life and potentially prevent further complications. Regular monitoring and a personalized approach to diet and lifestyle are essential components of effective CKD management. Let's embrace these changes and move towards a healthier, brighter future where kidney disease doesn't dictate our lives. If you found this information helpful, please give this video a thumbs up and share it with your friends and family. Don't forget to subscribe to our channel for more health tips and wellness advice. See you soon in our next video. Goodbye.